In Guernsey, every 5 years I would get perhaps one serious case of myocarditis. So when COVID came along, we were told that myocarditis was a serious complication in 5% of people. And with a population of 63,000, we had quite a tough lockdown in Guernsey, so we didn't have a huge wave in 2020. However, there was still significant burden of COVID. I had sick people coming out of intensive care, had been on ventilators for 3 months. And before the vaccines were released, I believe around 2,000 people that were infected. So if you say 5%, which is what the UK government website says is the risk of myocarditis post-COVID, then we're dealing is between 50 and 100 people that I should have become aware of having myocarditis from COVID. But I don't recall seeing one patient, and even the sickest patient coming out of intensive care who had been kept alive on adrenaline for 3 months. He had zero evidence of myocarditis. Cardiac ultrasound was normal. So I honestly cannot tell you that COVID causes myocarditis. If it did, I'd be concerned, wouldn't I? Because you would naturally assume that in my role as a cardiologist, I would be wanting to help prevent people getting injured from the COVID virus causing myocarditis. It was only until the vaccine came out that I saw this flare up. And it was impossible for me not to see it because the patients were presenting with problems. And so I had 25 cases in 2021. There were a lot of patients with pericarditis and chest pain, which I have a list of 20, but the list is greater than that because it's impossible running my day job trying to keep track of all these numbers. In 2022, we've had another 22 cases, and in 2023, we've had 11, but there are 19 cases which I'm waiting on further assessments because I get cardiac MRI on all these patients as part of their final assessment. I think there's been 5 deaths, and about 2 or 3 of those deaths have not been clearly documented. I remember one patient of mine, he had 9 cardiac arrests in a 24-hour period. So despite everything that we were doing for him, he was constantly going into cardiac arrest. And at that time, he ended up being treated with a defibrillator. He never got formally assessed as to whether he had myocarditis. But despite everything that we did for him, he ended up just dying a few months later.